Coronaviruses are in the news. Coronaviruses are a family of respiratory pathogens, usually quite benign, not unlike a lot of other RNA viruses. Although the COVID-19, or SARS-CoV-2, SARS-CoV-2, that's a quick name for it, is hypervariable. And hypervariable means that it changes its character regularly, which means it's going to be hard to characterize it at a point in time and then go off and do safety, tolerability, efficacy studies on a vaccine. Because by the time you have done all of that necessary background work and safety efficacy work, the organism has likely been promiscuous with its DNA, with its RNA, promiscuous with its genetic material, and changed. Now, more than 10% of the cases that have been reported are severe. And about 2% of the cases that have been studied thus far have passed. Oh dear. And depending on how you look at the numbers, somewhere between at least 25 or 30,000 and maybe twice or more that number of people in America passed because of the flu, because they are frail and infirm in almost all cases, at risk, overstressed, overfed and undernourished, environmentally intoxicated, through no fault of their own, but just it's the 21st century. So it is the people with chronic lung problems, especially those who smoke tobacco. It is those with cardiovascular disease. If you have coronary or atherosclerotic disease, you are more at risk of anything that changes the blood flow, that restricts the exchange of oxygen and carbon dioxide, which is characteristic of all of the respiratory, cardiorespiratory viruses. And if you're a diabetic who's not controlling your blood sugar, you're at higher risk. And the numbers I've seen have been about 10% of people with significant cardiovascular disease or prior lung respiratory problems, and about 7% of diabetics who are not controlling their hemoglobin A1C, for example. So if you're a healthy person, stay tuned, because I have suggestions to tune up your immune defense and repair system so that your risk goes down substantially, even as your understanding goes up dramatically. Now, for whatever reason, in the initial 30, 40, 50,000 people reported, men seem to be at more risk than women. But again, men do more tobacco smoking there. Men are more likely to be at risk of cardiovascular disease, etc. So stay tuned. By reference, this is not more aggressive than the SARS 2003 fear of pandemic, fear of widespread viral illness. MERS, another family virus similar to this. Actually, that one seemed to be more aggressive, but was contained with good public health measures, and most importantly, identifying those who are at risk and helping them rest and rehabilitate, recover, rather than persevere and possibly be significantly adversely affected. Now, how is COVID-19 spread? This is still an open question. Some people are suggesting that it may be a month or more of incubation after exposure before you know whether the person is or is not infected and able to communicate the infection to others. Usually it's about 2 weeks. That's what it is for most infectious viruses. So there we need to understand the host hospitality equation better. There's a professor named, I think it's Lori Grelinsky, and she points out that if you have a healthy lung function and get exposed and even infected, you'll recover and it'll be quite benign. It's the people at risk of lung, heart, and or metabolic problems like diabetes that are at risk. And so what do we do? What to do? And I'm going to offer you basically 10 doable options. For example, stay well hydrated. Water is your beverage of choice. Herbal beverages, yes. For any caffeinated or adult beverage, for any sweetened beverage, an additional glass of water. And so in essence, you should have a carafe of hard, mineral-rich water in front of you. And if the glass that goes with the carafe is full, drink it. And if it's empty, fill it. Repeat throughout the day. This means that you will want to go and urinate about every 2 hours while you're awake. Number 2, nature's natural antiviral is L-ascorbate. L-ascorbate means it's 100% natural, not half L and half D. As is most, ascorbate is synthetic and partially oxidized or damaged before you get it. So we recommend the fully buffered, fully reduced L-ascorbate, the one done in the traditional natural way under a nitrogen blanket so that the air oxygen does not damage the delicate protective antiviral antioxidant ascorbate. But it's the L-ascorbate, fully buffered, fully reduced that you want. Then, enhanced uptake magnesium with choline citrate, 2 capsules of the magnesium salts, a teaspoon of the choline citrate, at least 2 times a day, plus an additional dose if your urine after rest pH is below 6.5, and an added dose for every half pH unit below 6.5. Then we recommend a comprehensive super multi, so that's your super B complex, full mineral complex, and other cofactors, other essentials, sufficient to keep your healthy, hydrated urine sunshine yellow. Some kind of multi-herbal and micellized soft gel to enhance liver function in a comprehensive way. Some kind of restorative sleep preparation, for example, an Epsom salts and baking soda bath, maybe with a few drops of your preferred essential oil, and 5 minutes of abdominal breathing when you first get into the bath, and then 15 minutes of active meditation. For example, activemeditation.org is a resource that will orient you if you want to practice this kind of healing response, this kind of transitional relaxation, so that you're preparing for quality sleep. Now, eat what you can digest, assimilate and eliminate without immune burden. LRA by ELISA ACT tests are recommended, or however you want to determine what you can digest, assimilate, and eliminate without immune burden. In general, the Greek Mediterranean diet seems to be the healthiest for the quality of long-lived people, and it gives you the widest diversity in your microbiome or your digestion. You may want to improve the air quality in your room, bedroom or office or personal space with a room ionizer, a point-to-space discharge unit that recharges the electrons, it reduces the pollution in the air, it freshens the air without creating ozone. It doesn't smell like bleach. So, to your well-being we are dedicated. Understand that coronavirus is new and in the news, but more misunderstanding than understanding, and it seems to be another respiratory but hypervariable RNA virus that we're dealing with and will adapt to, even as we are constantly adapting to an ever-changing environment. Thanks for your interest.